The title of this project is Mom's Safety Seat. My name is Melissa Mark, and I am the presenter of this project from Physicians Creek Incorporated. Physicians Creek is a small entity involved with medical research and innovations. The author and inventor in this case is Dr. Adam Au. Basically, we are presenting this to Project X because of what it stands for. The crux of Project X is to project innovation and technology that will solve a problem of global dimensions. Baby seats have become the rule in protecting kids from death during motor vehicle accidents and driving in general. But in transportation, what safety measures are in place for mother and fetus during pregnancy? On further thought, this lofty duty of protective seats should begin at conception, and especially when mothers have gravid uterus during the second and third trimesters of pregnancy. The hypothesis is that the conventional lap and abdominal seatbelt offers the most protection for mother and fetus during traveling in airplanes, motor vehicles, buses, and other forms of transportation. Also, the design of the present conventional belt in cars, jets, planes, space shuttles, and other similar modes of transportation offers the safest protection needed for all other passengers. The three-point lap conventional seatbelt was initially developed in France in 1903 for planes and has since been adopted for cars. This is the approximate position of the conventional seatbelt straps across the pelvic region and uterus, as well as the abdomen, shown in the picture. The present peculiar problem of the conventional seatbelt just by sheer positioning and contact forces of the belt has been associated with placenta abruption, uterine rupture or laceration, direct fetal injury, maternal death, and seatbelt syndrome. Of course, there are several recommendations for use of the present seatbelt for protection. Drivers with seatbelts were safer than those without their seatbelts on. The biomechanical interaction between the pregnant female in the transportation seating area is complex, involving the steering wheel, as seen in the diagram on the left, side doors, and the gravid abdomen. Hence, some changes that have been made is the adjustment of the steering wheel and introduction of the airbag. However, one crucial force playing a role, and is often ignored, is the contract force of the seatbelt itself, shown here in the diagram on the right. Our research methods used are a review of clinical case reports and analysis of peer-reviewed publications that bear relevance to the subject through electronic and manual searches, and data from direct randomized interviews of pregnant patient subjects. A typical study that we would like to present to you is one with 120 automotive crashes involving pregnant occupants. Of these, 18% had the three-point belts, 49% had no seatbelts of any kind, 13% were restrained in some fashion, 6% only had the lap belt, another 6% had the three-point belt and airbag, 3% had an improper seatbelt, 2% only had the use of an airbag, and then another 3% with some restraint and airbag. This is the distribution of what safety measures were in place in this particular study. The outcome and pattern of injuries in that study was that 5 had some complications, 18 had no problems, 11 experienced direct fetal injury, 6 had uterine injuries, 8 experienced stillborn births, 32 had placental injuries, while another 6 had placenta injury and complications, with 17 experiencing placenta and direct fetal injuries, and then 8 had placenta and uterus injuries, 1 with uterus and direct fetal injury, 2 with uterus injury and complications, another 2 with placenta and uterus injury with complications, and lastly, 5 with placenta, uterus, and direct fetal injury. Here, the study population was general and not specific to pregnant women. Overall, as we can see from the numbers, the number of injuries experienced in the lumbar spine and the abdomen are staggering higher than the upper body. And of course, intuitively, injury in any of this anatomic area is dangerous to the pregnancy. And from the data findings we have seen in the previous slides, instead of the pelvic lap belt and/or the 3-point abdominal and pelvic belt, we would like to implement the use of the upper body restraint without pelvic restraint, which is a technological innovation based on preceding scientific data findings. It is the object of this global innovation to provide a rigid yet comfortable seating and protection for both mother and fetus in case of accident in cars, planes, boats, trains, helicopters, and other vehicles for transportation. Subsequently, we will show different perspective views of the invention of this seatbelt, which is composed mainly of 2 over-the-shoulder strap belts that are fastened to the seat and solidly in place across the chest without any pelvic attachments, and applicable to the transportation modes mentioned. Hence, the safest innovation presented here. The most important component consisting of 2 shoulder straps that are fastened securely at the center. And the rear view, showing a side fastener in figure 34 of this diagram. The concept is also applicable to airplane seats, which presently only has the perilous lap belt. And here in another diagram shows the mother's safety seat with a gathered mother in the sitting position. Is the mom's safety seat an overall better design that forms the basis for all future seat belts? Shown here are pictures of seating position. The top left indicates a pilot seat with an arrow pointing to the pelvic lap belt. The top right is an astronaut with a pelvic lap belt shown once again. And the bottom left is indicative of race cars with a slight modification and possibly even more dangerous with the strap secured in between the thighs. The prior designs, the lap belt alone and/or the abdominal shoulder belt, have been associated with and have the potential to cause spinal cord dissection, mesenteric tears, perforations of bowel and colon, pregnancy loss, rupture or laceration of liver and spleen, carotid dissection, laryngeal trauma, respiratory distress from diaphragmatic rupture, and bladder rupture. The next slide shows graphic images of bodily injury obtained from accidents involving lap-shoulder belt combinations and is not appropriate for those who are sensitive to graphic material. As stated, these are images of bodily injury resulting from accidents involving lap-shoulder belt combinations. Hence, in its unique form, the patent application extends to use in space shuttle seats, airplane seats, both passenger and pilot, rescue, private, and military helicopter seats, racing car seats, train seats, and boat seats. In conclusion, although the conventional 3-point seatbelt prevents expulsion of the passenger from the seat during an accident, it also poses some tangible injurious risk to intra-abdominal, spinal, and pelvic structures, especially in pregnancy. The innovative approach of using upper body restraint alone will not only offer the same benefit, but will also avert perilous restraining forces on the unborn fetus and other essential organ structures during traveling. Finally, where do we start with an invention of this magnitude? The most conventional Google car. Thank you.